Tanya and I'm from Jamaica, and not just Jamaica, Kingston, Jamaica. And so I am here to talk about cancer, more specifically breast cancer. So breast cancer is one of the most common cancer in women worldwide, excluding skin cancer. It can also occur in men, about maybe 1 to 100 cases, and that's per CDC website. The risk increases with age, especially after 40. Again, that's based on CDC website. But I have seen in my professional careers and also in friends and family people with breast cancer in their 20s and 30s. Risk factors may include a family history of breast or ovarian cancer, certain genetic mutations such as the BRCA1, the BRCA1, and the BRCA2. Hormonal factors, early menstruation, late menopause, or hormone therapy. Sometimes people may say, or per CDC website, again, it may say birth control. Lifestyle includes smoking, alcohol, obesity, lack of exercise. I've seen people who does not fall into any of this category, including my family members and friends who have been diagnosed with breast cancer. So let's talk about early detection. Number one, self-examination, checking your own breast regularly for lump changes or unusual discharge. Again, you can do that in the shower every day. Mammograms per CDC recommended for women, typically starting at about age 40 to 50, depending on the guidelines or depending on insurance. Clinical breast exam by your healthcare provider. Every time you have your yearly exam, please make sure your doctor or your nurse practitioner does your yearly breast exam. Symptoms: a lump in the breast or underarm, and I've seen the lump in the breast more so than usual. Changes in the breast size or shape, skin dimpling, some people may call it puckering, nipple discharge or nipple changes, pain in the breast, redness or thickening of the breast skin. And you're going to be meeting my family. We all hail from Jamaica, Manchester, Kingston, and just around the world. I have been impacted with breast cancer. I can remember as early as 30 years ago my aunt being diagnosed with breast cancer, and she had a mastectomy, which is the removal of the breast. She had one breast removed, which was the right breast. And then my cousin, her daughter, was also diagnosed with breast cancer. My mom, who is a twin, her twin sister was diagnosed with breast cancer at the age of 70. And so I remember my aunt going through treatments, chemo, radiation, and she overcame it. She beat it. And then it came back about 2 years ago when she was 78. This time, based on age and just different factors, she was able to beat it, and she passed away last year from breast cancer. I was diagnosed 3 years ago with breast cancer in my right breast, and I'll go through my story in a little bit. My sister was diagnosed in the left breast 13 years ago. She had a lumpectomy and she had radiation, and then this year, July 2025, she was diagnosed with an aggressive breast cancer. I remember her calling me one day telling me it was spreading through her body. She could feel it in her head, her shoulders, just throughout her body. And so she has been through a lot, and you'll get to meet her and you will hear her story also. So breast cancer has impacted a lot of people. But again, we in the Caribbean, Jamaica, that's whom we'll be focusing on. We'll be focusing on the Carr family, the Williamson, the Smith, Fishburne, and the Powell. And again, like I say, we hail from Manchester, St. Elizabeth, and Kingston. This is our story. Hi, and we are here at the Williamson, Carr, Smith, Fishburne. We're having our Sunday dinner, but this is no normal Sunday dinner. We are here at my sister's house, Claudette Smith Fishburne, and so it's good to be around family, because I remember back in July, I got a devastating phone call. My sister said, "Tanya, I'm sick." And I said, "Sick? Are you pregnant?" And I was just playing with her. And she said, "No, Tanya, I felt a lump." And so I started crying in the airport, but I remember what my God said. Beloved, I wish above all things for you to prosper and be in good health. And I said, I will not believe that report. And so my sister went and had her mammogram done. And this is my sister, Claudette Fishburne, and I'll turn it over to her. How do you feel having been around family since your diagnosis?
I've always been around family, but I'm just tired. My hair is falling out. I'm off work now, so I can really relax and take care of myself. That's the most important thing. I'm just already proclaimed healing. My chemo should end the first week of February 2026, but I have a lot of side effects like nausea, really tired, and hair loss. But other than that, God is good and I will prevail. So this is just another chapter in my life. Yeah.
And so families here celebrating just what she's been through. So when she was first diagnosed, and as African Americans, well, let me not say that we're Jamaican by birth. And so when she was first diagnosed, believe it or not, for my viewers out there, she found it herself. It was a self-breast examination. And she had a mammogram done 6 months before finding out. How did that make you feel doing your own self-breast examination? What would you say to your viewers?
Always be aware of your body, because I did feel something a couple weeks or maybe 7 days before I did my self-diagnosis. And also I was under a lot of stress at my job because I work for the airlines and it's a lot of rebooking and stuff like that, and it was a high volume season, so I was under a lot of stress. The comforting thing is my doctors did call me that they re-examined all the mammograms from the past 2 to 3 years and found that this is a new cancer. It's not the same cancer. And even though it's in the same spot, this is a more aggressive cancer. And they said they did everything correctly, and I have to believe that, and I have to have a faith that my doctors did me right. But again, I don't know. Yeah.
So again, she put the doctors came through for her after she found the initial lump, like we said. She did the mammogram. Can you walk us through the steps if you were supposed to tell another female? What are the steps? What would you recommend? You found the lump. You called your doctor.
I found the lump. I called my doctor. And I've had breast cancer 13 years before, prior to this. So you would think, okay, I know what to do. But when I called, I broke down. And I remember the nurse saying to me, we've done this before. We've been through this before. You can do this again. And she really calmed me down. So the second step it was really fast paced. After they found it, I had my mammogram like maybe 4 to 5 days later. They gave me a mammogram. Then it was like, yes, confirmation. You have a lump in your breast. However, you have 3 lumps under your arm. And I'm like, oh my gosh, that is even more that I bargained for. And then they're like, we have to get you to get a biopsy. I did a biopsy. After the biopsy, it was time for chemo. Then they're like 6 months of chemo, and then double mastectomy, and then reconstructive surgery. So technically I'm out of work for a year. So something that started as a self-diagnose has really changed my life.
So this is Claudette's daughter, and she's also, when you received the news that your mom had breast cancer, how did you feel? What would you say to other young women out there daughters whose mom is going through this?
It was hard to take. The only thing I could think to do was just to lay with her in bed and just hug her, because it's just not the kind of news that anyone wants to hear. The only way I could think to cope about it was just doing my own research about it and just finding holistic routes to help her, just to kind of ease both of our minds and just giving her positive words of affirmations to make her feel better about going about the whole journey. That was it.
Okay, so as you can tell, we're surrounded by family, and so this is Claudia, and Claudia, she's also one of the cousins of Claudette. So Claudia, Diana did her self-breast examination, and that's how she found the cancer. And so we're doing, as I said, we are Jamaican by birth, we're Jamaican American, and so just for women out there, and also for Claudette, how did you feel hearing the news about stage 3B breast cancer this close to home?
Well, I worked in oncology for a short time as a nurse. Seeing patients come in, some of them didn't even know they had any kind of cancer diagnosis that was going to come about. Some of them didn't even have cancer in their family. And so you have to be really strong for them. It's really hard for you to see it working. So when it's in your family, it's even harder. Yeah. There have been a few individuals in our family who've had breast cancer, and it's so close to home. These are my aunts, these are my cousins, and so it just makes me want to be more vigilant in my own study of it, my own practice of self-breast exams, different holistic cares, different Western medicines that can be beneficial to treatment. Sometimes you have to go the palliative route depending on how far along you are. So it's really hard for me. It makes me want to be very cognizant in my own health, the people around me, be very watchful of them, symptoms they may have that they don't even realize are related to cancer.
Okay. And so Claudette Fishburne, she's married. She has two children, Romani Smith and Athea Smith. And Romani, he's in the Air Force and he has his wife. And so, Romani, can you just come and tell us how you felt, and Josie, how you felt when you heard and what went through your mind and what is going through your mind right now? And what would you like to say, not just to your mom, but even to the ladies in the family, even to your wife? What are your thoughts?
It was very hard. It took me back to, I guess, my mom's first battle with cancer, and took me to a place where a lot of things felt outside of my control. So all I could really do was lean on family and to lean on their knowledge to make sure I was able to be a support for my family through this hard time.
I feel like there are a lot of moments in everyone's life where you have reminders that life can't be taken for granted, and you have to be so cognizant of your health and others' health and look out for that. And I think breast cancer is unfortunately so common, and we all have so many people that are friends and our family. We can relate to that, and a lot of people recover, and then unfortunately there is some loss, and so it is really it's a hard emotional battle for everyone involved. So it is, everyone has to lean on each other, and so I've been focusing on really trying to help Imani be a good support for his mom and help him be that rock for him. I also donated 15 inches of my hair recently for children with hair loss too. And it makes me think of my own health as well, where to look out for others, you also have to take care of yourself. And so getting screened for all of that is really important. So I think that unfortunately, it's one of those emotional reminders to make sure that your friends and your family and yourself are all taking care of that and going and getting their yearlies. So.
So again, Claudette Smith Fishburne, we grew up in the house together. It was our father, our mother. We have 2 older brothers, and so one of my brother Peter, this is Claudette's niece. And again, what would you like to say? Because your aunt, she found her breast cancer herself. She did her self-breast examination, and by the time she got to the doctor and they did all the examination, they did the biopsy, they did the ultrasound, it came back 3B, almost stage 4. At stage 4, a lot of people would have given up, but we can see she's fighting a good fight. What do you have to say to her? What do you have to say again to women out there? Our family, our family has been battling breast cancer. We lost 2 aunts, Aunt Gloria, Aunt Myrtle, because her sister Janet had it in the breast also. So what are your thoughts?
I'm generally shocked. This is my first time hearing about this. I am. I'm sorry that this is going on. We're all here for you in whatever way that we can be. I know it is something very serious. I know it has always run in the family. I do try to get checked every year just to be on the safe side. But God is good. He's going to do all that he can to take care of her.
Yes.
And we're here. We're just supporting you.
I'm so sorry about it, but it's so life goes. You just trust in God and God will heal you. You just have to call upon God. And one day he will touch you. He will heal you. Right? And he will heal you. Don't worry about it.
I proclaim the healing.
Yeah, those in life. We don't know what we have, we don't know what we're going through, but you just keep the faith.
Yes, I believe.
And just call upon it, and everything will be okay. Okay?
Yes.
God bless you.
Thank
God
you.
keep you, and God will provide, protect you on your way, my dear.
Thank you.
I do want to emphasize that cancer is a touchy subject, and when you hear the word chemo, it's not everyone's cup of tea. I did not like the idea of my mom considering taking chemo. I definitely went to the doctor's office with her and asked the nurse if we exhausted all of the options here before we led to chemo, and chemo seemed like that's the only route, that's the best option for us. So my way, like I said before, is to do as much research as I could and as I can, and I'm still doing research now to help my mother get through this chemo, and we're doing a really good fight. Everything's organic, and if her stomach is ever upset, we do the ginger extract, and that's been helping.
Yeah.
There has to be a balance of holistic route as well as treatment, because treatment is harsh, but it's about how you go about it. So I don't want anyone who's considering taking chemo, or who has a family member who's getting chemo, I don't want anyone to freak out or think that chemo means the worst case scenario. Yeah, the end. It's not the end, and it's about how you go about it, how you do your basic life, your daily life, like how your daily routine. Yes, yeah. And also just being mindful to not over exhaust yourself, because chemo takes a lot of your energy.
Yeah, when I get tired, I just sleep.
Just lay down, and when you do feel that energy, take advantage of that energy to walk around the house and maybe dust clean or something like that. Like, you don't have, this is the time for you to be in your solitude and to grow your relationship with God.
That's true.
So that's all I want to say about chemo. It's not the end all be all.
Natural beauty, you know. Yeah. No, I've never been someone shy until I seen your eyes. Still I had to try. Yeah. Oh yes, let me get my words right and then approach you. Woman, I'll treat you like a man is supposed to. You'll never have to cry. No, I know everyone can relate to when they find a special someone. she's royal, yeah, so royal, and I want her in my life. I never knew anyone so one of a kind. No, the way she moves to her own beat, she has the qualities of a queen. She's a queen. Ooh, ooh, what a natural beauty. No need no makeup to be a cutie. She's a queen. She's a queen. And when they ask what a good woman's made of, she's not afraid and ashamed of who she is. She's royal, yeah, so royal. And I need her in my life. I never knew anyone so one of a kind until the night that I seen your eyes. My queen, so supreme. I can see it in her eyes, the way she smiles. Hey, yes I and I know the king and queen crown, same time. So I never leave your side. Just stick with me through the trial times. Oh, and she says she no mind. Correct, I know good man is hard to find. And she can't about that giant no line. That's why she has no ties at this time. Yeah, I know many men are trying, but she needs to be more than wine and dine, because she's royal, yeah, so royal, and I want her in my life. I never knew anyone so divine. The way she moves to her own beat, she has the qualities of a queen, so supreme. Ooh, ooh, what a natural beauty. No need no makeup to be a cutie. She's a queen, so supreme, yeah. And when they ask what a good woman's made of, she's not afraid and ashamed of who she is. She's royal, yeah, so royal, and I want her in my life. I never knew anyone so one of a kind. No, no, the way she moves to her own beat, she has the qualities of a queen. My Nubian queen. Ooh, natural beauty, you know. Yeah, no, I've never been someone shy until I seen your eyes. Still I had to try, yeah. Oh yes, let me get my words right and then approach you. Woman, I'll treat you like a man is supposed to. You'll never have to cry, no. I know everyone can relate to when they find a special someone, and she's right.